So we obviously just completed our morning rounds, which honestly I thought was one of the most thought-provoking rounds discussions that we've had. And so Dr. Hardman, maybe you could just introduce yourself and what you do in medicine.
Sure, I'm a family medicine doctor. I work for Premier Family Medical. I've been there for about 9 years. Before that, I practiced medicine with the military. I was active duty for 7 years. I did a military residency, and after I finished my time with the military, I came here to Utah, and I'm still in the military. I'm in the Utah National Guard, and I'm about to be deployed.
Oh wow, where to?
Eastern Africa.
And when will that happen?
That'll happen in 2 weeks.
Oh.
I'll be there for 3.5 months.
Wow, I did not know that.
Yeah.
We'll miss you. You talked about something that I think has been on my mind quite a bit, which is what does 3 to 5 to 10 to 50 years look like in a patient's future? And you specifically talked about 2 things that we should be paying attention to. Could you enlighten us a little bit about what you said?
Well, there were 2 kind of contrasting ways you can look at patients when they come in, and I found some studies that indicated that studied correlation between radiological findings and patient outcome, long-term outcome, chronic pain, chronic disability, and there does not seem to be much, if any, correlation between what you see on MRI or X-ray and how patients do overall. On the other hand, with specifically I was talking about locus of control. With locus of control, that is actually a pretty strong predictor of how they're going to recover, how well they're going to do in general.
This concept of locus of control was a little bit new for me, but as you described it and you used the Polish people going through communism and holding on to some internal control with regards to religious attendance as an example, tell us a little bit about what locus of control means.
Locus of control is a way to describe how much control people feel like they have over their own lives. So somebody with a high internal locus of control, that means that they feel like they are the masters of their destiny. I have control over my life. My decisions and my actions determine where I'll wind up and how I'll do. People with external locus of control feel like how they, where they go in their life and how they turn out, that is determined by factors outside of their control.
It's in my clinical practice, I've noticed that if someone feels like something happened to them, they were in a car accident and now they have this problem that somebody else caused, or if they feel like it's some other resulting factor, they really struggle, more so than if somebody takes ownership of the issue or feels like they have some ability to improve their life. Is that kind of what you've seen as well?
That's exactly what I've seen, and until I found these studies referring to locus of control, I had never heard it put in those words before, but as soon as I read these studies, it all kind of fell into place. I see this all the time in my clinic, people who really feel like they are in control of how they, they're in control of their health and their well-being. They do much, much better than people who feel like it is all up to the doctor to fix me.
So I guess I have 2 questions for you. First is, as clinicians, how can we empower patients to bring that locus of control internally and enable them? And then how can we as patients do the same thing?
Well, as far as how can we as clinicians help patients to do that, I don't know if there's a really good evidence-based answer for that. I mentioned at the end of rounds that, can we as clinicians help people develop an internal locus of control? Once again, short answer is yes, but the long answer is all the studies show that it takes a lot of work, intense therapy, probably months or years of therapy to change that locus of control. This is something that is I don't know, I wouldn't say it's hardwired, but it's pretty deeply ingrained in us. And so can we as clinicians change that? Maybe a little bit, but certainly being aware of the issue and speaking to patients and interacting with patients as if they are the ones in charge, or the ones in control of their destiny. You know, just if we as clinicians speak to patients that way, hopefully that'll have some impact on their outcomes. I have to tell you, I mean, this may sound a little bit cynical. I did actually find one study that in a pain clinic where they focus heavily on locus of control as one of the modes of therapy, and the effects of months of therapy was not huge, and that was months of intense therapy. It was statistically significant, it just wasn't huge.
Mm-hmm. Well, I really appreciated what you said as I was listening to it, and have recently contemplated my own long-term ability to stay active and do the things I want to do. My wife is going to have a baby this summer. I'll be 43, and when the baby's 25, I'll be that much older, and when the baby's my age, I'll be in my 80s. What does that look like for me?
Is that why you read that Outlive book a couple months back?
Yes, yes, it's very much on my mind, is how we maintain our bodies and how we can have that longevity. And what I think I took from this for myself personally is that I do have some control over it, and the decisions I make and the things that I choose to do have a significant bearing on how much I'm able to do in the future, which for me was, I felt somewhat empowered by that. But good. Appreciate you spending the time speaking and talking with us this morning.
Sure. Thank you. Thanks for inviting me.